Lumps of one kind or another are a common reason for a visit to the doctor's office. The lump might be in the neck that the parents suspect is just a swollen gland, in the knee that the parents think is from sliding into third base last month, or under the nipple that the parents hope is due to puberty. I often enjoy seeing parents with these concerns in my own office. Sometimes the parents feel that they shouldn't even bother their doctor with this because it's probably normal. But underneath these hopeful, at-home diagnoses lies a common fear for breast lumps in boys. It might be a tumor. Most lumps in children are not cancerous and are not serious. Thankfully, childhood cancer is uncommon. But parents' fears are not unfounded. Childhood breast cancer is quite rare, but it certainly does occur, even in boys. In males of all ages, breast cancer accounts for less than 1% of all cancers. American Surgeon, 1999, 65 to 250-253. But if it is your son, any chance of cancer seems too much. And a lump might be the first sign noticed. Breast lumps in children often give rise to two immediate fears. Could it be a tumor? Or could something be going wrong with puberty? A third fear, will my child be teased, arises if the first two turn out to be no problem. When to be concerned about breast lumps in boys? Puberty is a time of dramatic changes in the body, especially in the reproductive system. These transformations are brought about by surges of complex and precisely balanced hormones. The last time your 12-year-old had these tides of hormones was when he was a newborn, but then the hormones were yours. Coursing through his blood, your hormones matured his lungs, made him ready for life in the big outside world, and along the way may have given him baby acne and breast enlargement, even nipples that leaked milk. This precious newborn season was gone in a blink. Now your 12-year-old is making surges of these same hormones on his own as his body turns into an adult, a miracle not unlike when you helped turn his body into a newborn's. There are 5 stages of the changes that occur during puberty, called Tanner stages or sexual maturity rating (SMR) stages. Breast lumps in boys are common during SMR3 and SMR4. In boys, SMR3 usually begins at about age 12 or 13 years and lasts a year or so, although it can be normal in our culture to begin as early as 10 years or as late as 14.9 years, according to Tanner, Journal of Pediatrics, 1985, 107 to 317. SMR3 is the time when the testes get clearly larger, the penis gets noticeably longer, then thicker in SMR4, and the pubic hair, though still small in amount, gets darker and starts to curl. Sperm is first produced during SMR3. Boys grow at their fastest during SMR3 and SMR4. Girls get their growth spurts earlier. With your son, you're probably seeing him outgrow his beginning of the year school clothes already, especially his shoes. During SMR3, the feet and hands usually grow first, then the arms and legs, and finally the trunk, giving them that adorable adolescent gawky look. Don't tell my 12-year-old son I said that. SMR3 also marks the beginning of significant underarm perspiration. The odor, as you've probably noticed, can start much earlier. And teenage acne usually begins at SMR3, continuing on until the end of puberty. In newborns, baby acne and breast buds often occur at about the same time. In the same way, many adolescent boys develop gynecomastia, true mammary breast tissue in a male during SMR3. The firm lump may occur under only one nipple, under both nipples, or under the two at different rates or sizes. The lumps are often tender when they are growing the fastest. In at least 90% of kids, these will go away on their own. They may disappear as quickly as in a few months, but it is not unusual for them to last up to 2 years. Nelson Textbook of Pediatrics, W.B. Saunders, 2004. In some children, they may persist without being a problem. Gynecomastia occurs in at least 40% to 60% of boys. For Treatment Medicine, 1998, 116 to 23-26. Gynecomastia can run in families, and when it does, the disappearance pattern tends to be similar in the family. Gynecomastia can happen in boys of any size, but it is more common in bigger teens, either taller, heavier, or both. Obesity can certainly be a cause of gynecomastia in some children. Clinical Pediatrics, 1998, 37 to 367-371. Gynecomastia is different, though, than fatty tissue in the breast area. Boys tend to store extra fat in the upper body, breast and abdomen area, but girls are much more likely to store it in the lower body, particularly the thighs. Pediatrics, 1998, 102, E4. This is the first place it goes on and the last place it comes off. If girls' breasts do enlarge by storing fat, this is usually one of the first places it disappears with weight loss. Times to worry about breast lumps in boys, not a newborn, if they begin before age 10 years or after age 15 years, especially after puberty is complete, if they are not directly under the nipple, if there is overlying dimpling of the skin, skin ulceration, or change in the color of the skin, if they feel fixed to the skin, if they are large over 1.5 inches, 4 centimeters, in diameter, if they don't go away within 2 years, if the nipples leak milk, blood, pus, or other fluid.